Imagine going to the bathroom as part of your normal routine, expecting nothing unusual, only to glance down and notice something off about your urine. Maybe it looks darker than usual. Maybe you notice streaks of red, blood where it shouldn't be, or perhaps the flow feels weaker, interrupted, as if something inside is blocking it. You shake it off, telling yourself it's nothing, just dehydration or something you ate. But what if it isn't? For thousands of men, this is exactly how the first silent warning signs of prostate cancer appear, hidden in something as routine as urination. The problem? Most ignore it. They assume it's just aging, stress, or maybe a minor infection that will go away on its own. Weeks pass, then months. The symptoms come and go, sometimes disappearing just long enough for you to forget about them. But beneath the surface, something more serious could be growing, unnoticed and unchecked. Prostate cancer is one of the most silent and underestimated killers of men worldwide. It doesn't announce itself with sudden pain or dramatic symptoms in its early stages. Instead, it whispers through subtle changes in urination, through discomfort that seems too mild to be a real problem, through signs that most men either don't recognize or are too embarrassed to discuss. But ignoring these signs is exactly what allows prostate cancer to develop silently, often reaching advanced stages before being detected. And by then, the fight becomes much harder. One of the most alarming signals that something is wrong is blood in the urine. It might appear as a faint, pinkish tinge, small dark streaks, or even a more noticeable reddish hue. The medical term for this is hematuria, and while it can be caused by infections or kidney stones, it is also a key warning sign of prostate cancer. Blood in the urine happens when cancerous cells in the prostate disrupt nearby blood vessels, causing leakage that appears in the urinary tract. Many men dismiss this symptom, assuming it's a one-time event or caused by something minor. But any presence of blood in the urine should be taken seriously and investigated immediately. Another symptom that often signals something deeper is a weak or interrupted urine stream. You might find yourself struggling to start urination or feeling like your bladder isn't emptying completely. This happens when the prostate begins to enlarge abnormally, pressing against the urethra and making it harder for urine to flow. While this can also be caused by benign prostate enlargement, BPH, in some cases, it is one of the earliest signs of cancer growth. Men also report needing to urinate more frequently, especially at night. But the frustrating part is that even after urinating, the sensation of needing to go again lingers. This occurs when the prostate obstructs urine flow, preventing the bladder from fully emptying. Over time, this leads to frequent urges. Even when little urine is actually being passed, the cycle becomes exhausting, disrupting sleep and daily activities. Many assume it's just part of aging or something harmless, but when combined with other symptoms, it could indicate a serious issue developing within the prostate. Perhaps even more unsettling is pain or discomfort while urinating. Many men associate pain with infections or bladder issues, but when it persists without signs of an infection, it raises a red flag for something deeper. This pain can feel like a burning sensation, pressure, or even a dull ache in the lower abdomen or pelvic area. Some men also experience painful ejaculation, a symptom that often gets overlooked but could indicate prostate inflammation or cancer development affecting the nerves and surrounding tissues. The problem with these symptoms is that they don't always appear at the same time, making them easy to ignore individually. One day you notice weak urine flow, but the next day it seems normal again. One week you feel discomfort, but then it disappears. This inconsistency is exactly what makes prostate cancer so dangerous. It tricks you into thinking nothing is wrong, and by the time the symptoms become severe enough that they can no longer be ignored, the cancer may have already advanced to a stage where treatment becomes far more difficult. But here's the critical part. Early detection can make all the difference. The earlier prostate cancer is identified, the higher the chances of successful treatment and even complete recovery. That's why these small, seemingly insignificant changes in urination should never be ignored. If something feels off, if something looks different, If your body is giving you signs, you owe it to yourself to pay attention. So what exactly happens inside the prostate when cancer begins to form? How does it grow, and why do these symptoms appear? To truly understand what's going on, we need to take a deeper look at how the prostate changes when cancer develops, and why those changes could mean the difference between life and death. The prostate is a small gland about the size of a walnut, but when something goes wrong, it can cause life-changing consequences. It sits just below the bladder and surrounds the urethra, the tube responsible for carrying urine out of the body. Because of this location, any change in the prostate's size or function can directly impact urination. But what happens when the prostate is no longer functioning normally? What happens when cancer begins to take hold? At first, the changes are almost invisible. The cells inside the prostate, which should divide in an orderly way, begin to multiply uncontrollably. This doesn't happen overnight. It can take years before the first noticeable symptoms appear. But the silent growth of cancerous cells creates pressure within the prostate, slowly affecting how it interacts with the bladder and urethra. At the beginning, this pressure is too small to cause major issues. Then as more cells multiply, the prostate starts swelling abnormally, pressing against the urethra. Men who develop prostate cancer often confuse the first symptoms with benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. Both conditions cause difficulty urinating, weak flow, and frequent trips to the bathroom at night. The difference? BPH is not life-threatening, while prostate cancer has the potential to spread to other parts of the body, making early detection crucial. As the cancerous growth continues to expand, the urethra becomes even more compressed. Urination, once an effortless process, turns into a struggle. The bladder starts working harder to push urine through the narrowing passage, leading to bladder fatigue. That's why many men with prostate cancer report a constant sensation of needing to urinate, even after just going to the bathroom. The bladder simply can't empty itself completely because the prostate is blocking the normal flow. If you're ready to take control of your health and make smarter choices, hit that like button and subscribe so you never miss out on important life-saving information. And then there's the issue of blood in the urine, a terrifying sight for any man. What many don't realize is that as cancer grows, it can disrupt tiny blood vessels inside the prostate. These vessels burst, leaking blood into the urine. Some men notice a pinkish tint, while others see small streaks of red. In more advanced cases, the urine may appear dark or rust-colored due to increased blood content. This symptom alone should be enough to trigger immediate concern, yet too many men ignore it, hoping it will go away on its own. But the problems don't stop at urination. As prostate cancer progresses, it can spread beyond the prostate, reaching surrounding tissues, lymph nodes, and even bones. Once cancer spreads to the bones, a common site for prostate cancer metastasis, severe lower back pain, hip pain, and stiffness can develop. What began as a minor urinary issue can evolve into something much more dangerous, affecting mobility and overall quality of life. One of the most concerning aspects of prostate cancer is how quietly it develops. Unlike many other cancers that cause obvious symptoms like extreme fatigue, weight loss, or chronic pain, prostate cancer in its early stages often remains hidden, with symptoms that can easily be dismissed. Some men may only experience mild discomfort or occasional changes in their urine stream, making them delay seeking medical attention. And that delay, it could be deadly. Prostate cancer, when caught early, has a nearly 100% survival rate. But once it spreads beyond the prostate, survival rates drop dramatically. The difference between life and death often comes down to early detection. So how do you know if you're at risk? What factors make prostate cancer more likely to develop? And at what point should you stop ignoring symptoms and seek medical advice? These questions matter, and answering them could mean catching prostate cancer before it becomes unstoppable. Understanding who is most at a risk and when to take action is the next critical step in this life-saving conversation. Not all men will develop prostate cancer, but some are at a significantly higher risk than others, often without realizing it. While the disease can affect anyone, Certain factors make it far more likely to appear, and understanding these risks is the first step toward prevention and early detection. The question is, are you at risk? Age is the biggest factor. If you're over 50 years old, your risk of developing prostate cancer increases dramatically. But by the time you reach 65, that risk multiplies even further. This is why prostate cancer is considered an aging disease, affecting older men at much higher rates. However, the real danger isn't just age. It's the fact that most men don't undergo regular screenings, allowing the cancer to grow unnoticed for years. Genetics also play a powerful role. If your father, brother, or grandfather had prostate cancer, your chances of developing it double. And if multiple close relatives have been diagnosed, your risk is even greater. It's a silent inheritance, one that you can't see or feel until it's too late. This is why men with a family history should start screening at 40 or earlier, rather than waiting for symptoms to appear. Lifestyle choices are another key factor, though many men ignore them. A diet high in processed foods, red meat, and unhealthy fats can fuel inflammation in the body, creating an environment where cancer cells thrive. On the other hand, men who follow a Mediterranean-style diet, rich in vegetables, fruits, fish, and healthy fats, are far less likely to develop prostate issues. But here's where it gets interesting. Certain foods like tomatoes, rich in lycopene, green tea, and cruciferous vegetables, broccoli, cauliflower, and Brussels sprouts, have been linked to lower prostate cancer risk. But it's not just about what you eat. Physical activity matters more than you think. Studies show that men who lead sedentary lifestyles have higher rates of prostate cancer. Why? Because lack of movement weakens the immune system, slows circulation, and allows excess weight, especially around the abdomen, to promote inflammation and hormonal imbalances. In contrast, regular exercise, even something as simple as 30 minutes of walking a day, has been shown to lower the risk of aggressive prostate cancer. Then there's something most men never consider: testosterone levels. While testosterone itself does not cause prostate cancer, higher levels of this hormone can fuel the growth of existing cancer cells. This is why men undergoing testosterone replacement therapy, TRT, should be closely monitored for prostate health. If left unchecked, increased testosterone can accelerate the growth of undetected tumors, turning a small problem into a deadly one. However, one of the most overlooked connections is between prostate cancer and sleep disorders. Research has shown that men who suffer from chronic sleep deprivation, especially due to sleep apnea, have a significantly higher risk of developing aggressive prostate cancer. Poor sleep weakens the body's ability to regulate hormones and repair cellular damage, creating a perfect environment for cancer to develop and spread. But let's say you don't have any obvious symptoms yet. At what point should you stop waiting and see a doctor? The answer is simple. The earlier, the better. The PSA, prostate-specific antigen, blood test, is one of the easiest and most effective ways to detect prostate issues before symptoms appear. It measures the levels of a protein produced by the prostate, and elevated levels can indicate cancer, an enlarged prostate, or infection. When combined with a digital rectal exam, DRE, which allows a doctor to feel for abnormalities in the prostate, early detection rates skyrocket. Despite this, many men avoid these tests out of fear or embarrassment, and that mistake can cost them their lives. The reality is, prostate cancer detected early has a survival rate of over 95%, but once it spreads, survival rates drop drastically. The difference between life and death often comes down to a simple checkup. But if the worst happens, if cancer is found, what then? What are the treatment options, and what steps can be taken to fight back? Understanding the latest advancements in prostate cancer treatments, from surgery to cutting-edge therapies, is the next critical step every man needs to know. Because while early detection can save lives, knowing how to fight the disease if it appears is just as important. Now, I want to hear from you. Drop a comment below and type, "I want to live better," if you're committed to prioritizing your health and well-being. Let's take action together. Imagine this. You go to the bathroom expecting everything to be normal, just like every other day. But something is different. Your urine doesn't look the same. Maybe the color is darker than usual. Maybe you notice a pinkish tint or streaks of red, blood where it shouldn't be. Or perhaps the stream feels weaker, like something inside is blocking it. You shake it off, convincing yourself it's nothing serious. Maybe you're dehydrated. Maybe it's just temporary. But deep down, you know something isn't right. This is exactly how prostate cancer starts revealing itself for many men, through small, seemingly harmless changes that are easy to ignore. And that's where the real danger lies. Prostate cancer is one of the most silent and underestimated killers of men worldwide. It doesn't start with unbearable pain or dramatic symptoms. Instead, it sends subtle warning signs. And the most alarming part, most men miss them. They brush them off, assuming it's just aging or something that will pass on its own. But while they wait, thinking it's nothing, the disease continues to grow, undetected, often reaching advanced stages before being diagnosed. One of the biggest red flags is blood in the urine, a condition known as hematuria. This could be light pink, rusty colored, or bright red. Many men assume that blood in the urine is caused by a urinary tract infection or kidney stones. And while those are possibilities, it can also be one of the earliest signs of prostate cancer. The reason? As cancer develops in the prostate, it can damage nearby blood vessels, allowing blood to leak into the urinary tract. Some men notice this symptom once and then never see it again, convincing themselves it was just a one-time occurrence. But that's the mistake that could cost them their lives. Then there's changes in urination itself, something that seems so common that most men never even think twice about it. You might suddenly notice that your urine stream is weaker than before, or that it stops and starts, instead of flowing steadily. This happens when the prostate grows abnormally and begins pressing against the urethra, narrowing the passage where urine flows. Over time, this obstruction makes it harder and harder to empty the bladder completely. At first, you might think it's nothing, a slight hesitation when starting to pee, maybe taking longer than usual. But these small changes are the early whispers of a potentially life-threatening condition. Frequent urination, especially at night, is another overlooked symptom. You wake up multiple times feeling the urge to pee, yet when you get to the bathroom, only a small amount comes out. Your bladder constantly feels like it's full, yet you can't empty it completely. What's happening? As prostate cancer develops, it can interfere with the bladder's ability to fully release urine, making you feel like you constantly have to go, even when there's barely anything left inside. This vicious cycle becomes frustrating, disrupting your sleep and draining your energy during the day. But most men just assume it's a normal part of aging, never realizing it could be something far worse. Beyond difficulty urinating, some men experience pain or burning while peeing. While this is commonly associated with infections, if there are no signs of infection, but the discomfort persists, it could be another silent warning sign of prostate cancer. The same applies to painful ejaculation, a symptom that many men are too embarrassed to talk about, but is a potential indicator of inflammation and abnormal changes within the prostate. Here's the scariest part. These symptoms don't always appear together. One day your urine flow might feel weak and the next day it's fine again. One week, you notice slight discomfort and the next, it's gone. This inconsistency is what makes prostate cancer so dangerous. It tricks you into believing there's no problem. Many men go months, even years, without seeing a doctor, assuming that because the symptoms come and go, they must not be serious. But by the time the symptoms become persistent and impossible to ignore, the cancer may have already spread beyond the prostate, making treatment much more difficult. But here's the good news. Early detection can save lives. Prostate cancer, when caught in its early stages, has a high survival rate, nearly 100% when detected early. That's why paying attention to your body's warning signs and acting quickly can mean the difference between a simple, treatable condition and a life-threatening battle. If something feels different, if something looks unusual, don't ignore it. Now, the big question is, why do these symptoms happen in the first place? What exactly is going on inside the prostate when cancer begins to develop? To fully understand what's happening, we need to take a closer look at the science behind prostate cancer, how it grows, and why these early symptoms appear. The more you know, the better you can protect yourself. And that's exactly what we're going to uncover next. If you found this information valuable, don't forget to like, comment, and subscribe so you never miss out on crucial health insights. And now, I want to hear from you. Comment below and type, "I want to live better." If you're committed to taking charge of your health, your body is sending signals. The question is, will you listen? Thanks for watching, and I'll see you in the next video.